Good morning, everyone. On behalf of the ASCP, we'd like to welcome you all back to the Building Bridges webinar series in service of the CDC One Lab initiative. My name is Susan Harrington, and I'll be one of your co-moderators for today's session. Just a little bit about myself. I'm a medical director in the microbiology laboratories at the Cleveland Clinic. I'm also a longtime volunteer for the ASCP. I'm currently serving as chair of the Workforce Steering Committee and as a member of the board of directors. Previously, I also represented the American Society for Microbiology on the Board of Certification's Board of Governors, and I was privileged to serve that group in various capacities. Tawana, do you want to introduce yourself?
Sure. Hello, everybody. My name is Tawana Wilson, and I currently serve as the System Technical Director of Chemistry for Compunet Clinical Laboratories, where I oversee multiple laboratories within our division. So we have multiple labs. Currently with the ASCP, I serve on the Workforce Steering Committee along with Dr. Harrington. I also serve on the Diversity, Equity, and Inclusion Committee. I am a career ambassador, and I've been a longtime volunteer with ASCP and had the opportunity to train in Rwanda, Africa with ASCP. So I'm excited to be here, and I'm excited to be with all of our guests, over 300 of you here today.
Thank you. So we want to start by encouraging everyone to check out our website where you can find out more about the free laboratory education and resources available through CDC One Lab and ASCP's One Lab grant. This webinar series highlights the diverse array of laboratory career paths and how exposure to formative experiences through collaborations and unique training opportunities can shape those career trajectories. We'd like to acknowledge that this resource was made possible by funding from the CDC. However, ASCP is solely responsible for its content, and the viewpoints shared do not necessarily represent those of the CDC.
Today's session, and you are in for a treat, will feature 4 fantastic laboratory professionals across dynamically varied roles supporting clinical laboratory testing, who will share a glimpse into their career paths. We'll then have our question and answer session, and we will conclude with some reminders. We'd like to quickly share a few housekeeping items with you. Lines will be muted, so please add all of your questions for the panelists into the question and answer box so that we don't miss any, and we will moderate questions at the end of the session. Closed captioning for the webinar is enabled for any interested parties, and a link to today's recorded session and slides will be available on the website in 2 weeks. So before we get started, we wanted to share a quick overview of the career map template that our panelists will use to present from today. Education and work history will be on the left column. Career influences will be in the middle column. And on the right column, you'll see a quote that the career advice quote that resonate with the panelists. So, are you ready to get started? Well, we will kick it off with our first dynamic presenter, Terry McElhatton, and then our subsequent presenters will introduce themselves. Terry? And so while we are giving Terry just another minute or so, we might have to go to our next panelist and come back to all the awesome, amazing information that Terry has for us. Okay, so we're having a bit of technical difficulty, so we will go with our next panelist. Alfonso Ortiz, I will kick it off to you, and then we will come back to Terry.
Good morning. I just want to check to see that you guys can hear me. Okay.
Yes, you sound good.
Awesome. Well, good morning, guys. My name is Alfonso Ortiz. I am currently now the Assistant Director for Pathology Services here at University Health San Antonio. So with that being said, of course, my current responsibilities are to oversee pathology service projects to improve workflow, as well as to implement new lab technologies and laboratory information systems and integrations, as well as to ensure compliance with regulatory standards. Now, of course, with all that being said, my path and my career path, of course, was navigated through the multiple steps in the career ladder that I've taken with the opportunities that have gone my way. I started off in, by going through school, like most of you, of course. My story, of course, is, originally I didn't know much about the laboratory field, if not anything at all. However, I was originally a music major. And then, of course, I decided that I wanted to change a major to the medical lab field. But of course, that came with some challenges along the way. So I went over to one of my, the laboratory, I guess the Allied Health Professions department over at the community college, and then became informed, but it wasn't with laboratory at first. It was actually radiology. And then because, I've applied for that program, then became first alternate. And then it was in the background where one of the professors, if not the director of the medical laboratory technology program there at the community college, overheard saying, it's like, hey, I heard you were first alternate here at radiology. Perhaps you may be interested in the laboratory field. And of course, she gave me all the information and I said, yes, I am interested. Therefore, that kicked off the first domino in my career path in becoming a medical laboratory technician there in Laredo. Of course, for me, that was a stopping point because I didn't know much better. Of course, being that was like 20 years ago, I didn't know much better into saying it's like, where this can lead me to. And if it wasn't for like the folks that were in place at the time that came through my career, of course, the recruiter from the University of Health Science Center San Antonio came and spoke with me and let me know about the potential opportunities that a Bachelor of Science in the medical laboratory field could provide, that I eventually came convinced and moved here to San Antonio to, advance my education. So I completed my Bachelor of Science degree at the University of Health of Texas, San Antonio in 2007. And then that's where I began my first position as a medical laboratory scientist in the hematology department. Um, with that being said, of course, you're working the bench, learning the ins and outs of the actual department. And then it wasn't until 2009 where my first formative experience in my lab career began. And the way it began first is by me saying, yes, I want to be involved. Yes, I want to be part of this new experience of validating an instrumentation. Then, of course, not knowing a whole lot about instrument validation, that experience gave me the visibility of what entails to being part of that validation that we're doing back in 2009. Of course, not only did it give me visibility with our supervisors, managers, but also gave me visibility with our medical directors and folks outside of the laboratory to learn more about, what the type of technology that we are implementing in the department. Of course, that was within my medical laboratory science, my medical laboratory science career, and that first formative experience helped me jump to my position over to a senior medical laboratory scientist, where now, because of my experience, that made me the go-to person, if not the subject matter expert, for all the instrumentations that we implemented and validated throughout the actual department. Um, then, of course, then came in my second formative experience, which was our laboratory information systems and middleware implementation that occurred in 2015, where we were implementing, soft, and then, of course, a middleware within the department. Of course, that, like, being that we're implementing both at the same time, it's like sort of like learning two LISs at the same time for the department. Knowing what I knew with the validation experience as a senior medical technologist or senior medical laboratory scientist, like, I implemented or got those experiences and led my team to pretty much to have a successful go live for this new implementation of this LIS system. So not only that, but there was more collaboration that we had to do with our with folks outside of the laboratories, such as our hematology, oncology units, our AD departments, all our pathologists. That they all want to be part of this new implementation software because it impacts us as a whole. And so that in turn, of course, led to my step into going into a supervisory role, and pretty much, with those bridges that I formed, that helped me communicate a lot of the workflows that we had ongoing within the department, as well as a lot of the leadership experiences that I had also helped me lead our team to become a more efficient department. So within those experiences, of course, because there's like several jumps or several career advancements that I took there. There are more from the technical piece. Of course, with that being said, I had to position myself into learning those skills outside of being of the technical piece, which more like the manager or the administrative portion. So I've utilized the resources that the health system provided, such as our Management Development Academy, or our prior learning, so we can attend management seminars and supervisor leadership training, because I had to make that jump, or had to make that transition from a medical laboratory scientist to a supervisor role. I had to learn the ins and outs of being a more efficient supervisor, and those tools and resources that were provided to me helped me get into the lab manager role here at University Health. So, with the experiences from that I've learned through the validation process, the laboratory information systems, and of course the learning of the prior learning, as well as the Management Development Academy experiences that I got while I was, while I was lab manager. Essentially, the health system was pursuing into implementing a total wide epic HIS implementation in 2018. So therefore, with the experiences that I had from were the first experiences that I had with our LIS in 2015, that helped me become the project laboratory manager for pathology services. So pretty much helping with the EPIC HIS implementation from the laboratory perspective, and ensuring that we get the appropriate departments to be part of the sessions that are included as part of the implementation, as well as the collaboration that we need, not just from the laboratory side again, but from all the other parties outside of the laboratory. Of course, these were implementations that were going to go in 2020, which, I mean, that year in itself, I mean, it was a COVID year. So there was other items that were, that were going on as far as like, building a new COVID lab or doing more renovations or pretty much becoming like the data analyst for getting information for our laboratory during that time that helped me become the senior laboratory manager of the department. So a lot of these experiences helped me go on to the next step of my laboratory pathway. And of course, now it's like becoming the assistant director of pathology services. All these experiences that I've gone through my way that have formed my pathway have helped me and then become where I am today, which is the assistant director of pathology services. As far as like building bridges within the laboratory community, it's always great to be involved. Networking, it was key. Networking is key to building that connection with the laboratory community and the profession. And it's very important, not just within, but especially outside of the laboratory. You want to make those connections to help folks understand what is going on within the laboratory. And in addition, of course, being involved with the ASCP, Council of Laboratory Administration, has also helped me gain that visibility and gain that knowledge that I know to help me form my career and advance it. In addition, of course, this past year in 2024, I helped form the ASCP Texas Riverwalk chapter. This is a fairly new chapter that formed in February of 2024. And we're proud to say it's like, this has helped us in like all over as a state and as a whole laboratory community come together within the community's website, so that way we can engage within each other and then find more, ways to communicate, talk about what are some of the common issues, or jot down ideas for any workflows or any types of implementations that you may be experiencing in your parts of the laboratory. So essentially it allows for for communications and networking as well. Of course, a lot of my valuable skills that I've gotten, of course, we had a lot of leadership skills, process improvement, collaboration, my technical skills, which are like, the project management, workflow optimization, and laboratory information system implementation have helped me grow into where I am today. But a lot of this is like themed through my continuous learning and adaptability, which were the key to my success into, becoming or helping me grow within my laboratory career pathway. So if there's one key takeaway or my advice to you all who are on the call is to never stop learning. And if there's an opportunity there, simply say yes to that opportunity, as it can help you advance your career in as part of your pathway.
All right, thanks so much, Alfonso. We'll go back to Terry now. Terry, go ahead.
Hey, thank you, everyone. I'm so sorry before I got booted off, so I had to join back in. So my name is Terry Macala, and I am the program director and the principal instructor for the Geisinger School of Phlebotomy. We are located in the northeastern and central part of Pennsylvania here in the United States. So I want to thank ASCP and everyone for joining our Building Bridges today. Nice to have so many people join us online. So to start my career trajectory, I guess I have to go back to high school because back then we had a group called the Medical Explorers. And so every month we got to see a different part of the hospital, got to see a different career path. And as part of that, we got to go to different departments throughout the hospital. And so one day I was in the emergency room, and although I had aspirations of going in to be a pediatrician or perhaps a pediatric nurse, I kind of learned pretty quickly that I did not really like to see bloody things. So it's kind of ironic that I actually work in a laboratory, collecting and performing, blood analysis. But it was kind of an ironic situation. So the nurse, I had ordered, labs on this patient. And so the medical laboratory scientist came in and, drew blood on this patient. And I'm like, what are you going to do with that? And she's like, well, I'm going to take it back to the laboratory and test it. And I'm like, well, can I come and watch? And so the nurse said, yeah, sure, go ahead. So back to the laboratory I went, and I got the opportunity to see her perform a blood count. While things were spinning in the centrifuge. She told me she was going to put those on another analyzer to test those. I had the opportunity to see a urine dipstick for a urinalysis. And then, of course, the thing that got me hook, line, and sinker was when I saw her perform a blood type. And now this is back in 1979. So think about how primitive blood bank was back then. And so we had the old-fashioned, lighted, glass that we put the anisera and the blood on, and we had to see the agglutination. And as soon as I saw that, I thought, I want a career in laboratory medicine. And so that's kind of where my career trajectory starts. So moving forward, my current responsibilities as a program director here for the School of Phlebotomy. So I was the startup person. So I got to, do all of the curriculum and develop the program, the clinicals, all the documents that are required for that. We are now in our 17th year here at Geisinger, and in April, we'll be graduating our 43rd cohort. So it's been a wonderful opportunity for me to be involved with laboratory medicine, getting this program up and started and continuing to be successful to graduate our students into the healthcare field of laboratory medicine. So I also have the opportunity to sit on our phlebotomy best practice team as the ops advisor, and we get together monthly to basically get together from all of our hospitals and our clinics and mobile team to create the best practices for our phlebotomy team system-wide. So we have a 9-hospital system. We have a vast counties of clinic sites and mobile teams. And so we want to make sure that not only our phlebotomy team is following these best practices, but we have taken our training out to our non-lab personnel in the hospital. So our nurses, our ED techs, and our patient care technicians who are also going to be drawing blood here at the healthcare system. And so that ensures that we kind of have the same procedures and policies being followed throughout our entire hospital system. So on to some of my formative experiences. So one of the greatest opportunities that I think I have come across in my career is to be a part of the ASCP, and of course, being asked to be on the phlebotomy exam committee and later the MLA exam committee. And I remember my first day in the boardroom, and we were getting ready to get started, and I said to 2 of the girls that were sitting there from ASCP, like, can somebody pinch me? And they kind of like looked at me with this perplexed look. And I said, I can't believe I am sitting on the exam committee of, the most elite certification, in the world. And so that kind of really started my trajectory as to coming involved with more of laboratory medicine type of opportunities. And so from there, I basically have also volunteered with ASCP as an ambassador, and I also represent for them as the program director on the ASCP Facebook page. So some of my other formative experiences have me involved with NACLS. So NACLS is the National Accrediting Agency for Clinical Laboratory Sciences, and I serve as the program educator on this committee, where I get to review medical laboratory science programs who are seeking accreditation. And so this has helped me tremendously to learn the accreditation styles, the writing that is necessary for the self-studies, and was very helpful and instrumental when I had the opportunity to write my self-study for our program to gain this accreditation. So in recent years, I've also had the opportunity to sit on 3 Clinical and Laboratory Standards Institute document development committees. And this has basically given me the opportunity to hone in on my writing skills, to help create the standards and the guidelines that we use today in laboratory medicine. So at Geisinger, I'm also part of our Health Professions Education Council, and this helps to promote and enhance education programs within our own healthcare system, where we not only host a phlebotomy program, but we also have a histology program, and we also have a medical laboratory science program that was started back in 2024. So I'm extremely passionate about increasing the knowledge and the skills of our phlebotomy team, and also advancing phlebotomy practices. So we're kind of researching the possibility today about our phlebotomists maybe getting involved with vascular access devices and using guided ultrasound to be able to stick some of our difficult patients. And so this is just another level of training for our phlebotomist. Another thing coming out and learning a new skill to their scope of practice. And so we feel that this would be something really worthwhile, especially for a large healthcare system like ourselves, where, like I said, we're feeding 9 hospital systems. We've got probably over 50 clinic sites and 4 mobile teams. So having these expanded functions, I think only enhances the skills of our current phlebotomy team. So how do I build bridges within my lab community? So at Geisinger here, we host a lot of different types of high school career days. And one of the newest things that they did this past fall, kind of like right before Christmas, is we hosted a dinner and dessert career exploration evening where we had students from various high schools. They got to bring a parent. And over dinner and dessert, we basically kind of discussed our own career trajectory and what led us to the profession that we picked here today. And so this was pretty nice because all the students get the opportunity to hear from a variety of different healthcare professionals, and they got to ask us questions. And it was really, really an enlightening evening. I thoroughly enjoyed it, and I'm hoping we're going to plan another one here for the spring. So I also continue to present at laboratory conferences to help to educate and keep knowledgeable for our fellow medical laboratory professionals. So some opportunities of interest for me. I do serve as an ASCP ambassador, and I promote the laboratory profession through our Building Bridges series, which of course you're all attending today. I began teaching way back in 2000. And of course, I'm very, very passionate about the love for our profession, and I continue to advocate for those who are interested in science to just take a walk into a clinical laboratory, see what we're all about, find your own career path. Just like Alfonso had mentioned, find those doors, find those avenues to take you out into the field and see where your career can actually go. So for valuable skills, one of the things I really rely on are communication skills. I think this is one of the most important attributes when it comes to not only educating my students, but also like managing things with your fellow colleagues and your fellow coworkers. I think one of my best pieces of advice I say to my students is that they're the lifeline for our laboratory and to our patients. And so I ensure that they understand blood collection practices, and I let them know that the policies are not really open for creativity. So sometimes I joke about that and I'll say, if you want to be creative, go to art school. But there's not really any room for that here in laboratory medicine because our patients, of course, are at the forefront for us, and we want to make sure we're offering them the best care possible. So some of the other things that I like to hone in on too is the opportunity for organizational skills. And a lot of my students are first time, college level students. So sometimes this becomes, a task for them till they kind of get all their ducks in a row, so to speak. But I want to instill in them this valuable skill because it's not going to only help them in school, but also in their personal life. And so I encourage them to take on phlebotomy challenges. So this is basically going to strive them to, have an effort in other things. Instead of just like honing in on 52 things to learn well, focus on your one thing. Like, what is one thing you really want to do well, and one thing that you're going to do in your career that's going to excel you to the next level. So one of mine was actually learning pediatric phlebotomy. So unfortunately, I pulled the short straw when I was in my medical laboratory science program, and I ended up getting stuck doing the OB, peds, and the nursery. And so I kind of had to get good pretty quickly because I was now basically charged with sticking babies and children. And so I tell my students, do the jobs nobody else wants to do. That's what's going to make you marketable. And so my first position as I became a medical laboratory scientist is the hospital I worked for only had one outpatient phlebotomist. And so the medical laboratory scientist went up on rounds every single day. And of course, since I was the new kid on the block, I was now charged with peds, OB, and the nursery once again. So having that skill, of course, and learning that through my clinical year really helped me when I got into a larger healthcare system to be able to stick these children. So one of the other skills that I've developed over my years was my writing skills. So sitting on those 3 CLSI document committees really helped to polish my writing style. That was really needed for those intricate documents and guidelines that we were creating. And so this skill actually gave me the courage to basically, I was asked to be a co-author on the 11th edition of the phlebotomy handbook after one of the authors had passed away in 2024. So being asked to be a writer on this text has truly been an amazing opportunity for me. It's brought me out of my comfort zone to take on this, new challenge in my life. And I credit all the skills and the knowledge that I gained in laboratory science journey to help me to take on this career achievement. So I encourage all of you that are out there today, find something that you want to do. Come out of your comfort zone and take on challenges as I did. So you're never going to get a home run, like they say, if you're going to just stay in the dugout. So my quote for you today is one by Einstein, and I use this, religiously in my teaching. So education is not just the learning of facts, but it's also training your mind to think. And so for everyone here on the call today, come out of your sandbox, continue to think outside of your comfort zone, attend ASCP conferences, take a leadership class to start your own trajectory in the laboratory medicine career ladder. So embark on external opportunities like volunteering with ASCP and other laboratory organizations. And this will open up doors for you on your own career path. Basically, as they say, nothing ventured, nothing gained. So I encourage you all to become involved, find something outside of your work activities. And, just like Alfonso said, he came out of his comfort zone and went into different things that helped to formulate his experiences in his laboratory career. So I want to thank you all. I want to be mindful of our time for other speakers, but thank you for inviting me. And I hope you all enjoyed our path to our career journeys today. Thank you.
Thank you so much, Terry. It was great to hear your experience, and we really value your sharing. We're going to turn now to Tom Alexander. You're up, Tom.
Okay, thank you, Susan, and thank you everybody for attending this and being with us today. Wow, I don't know that I can follow Alfonso and Terry with their talks. My career path is very different, however, from what everybody else has done, because when I started out, I had no idea what the clinical laboratory was. And I never started out trying to get into the clinical laboratory. I fell in love with immunology as a undergraduate student. Actually, Susan, it was a microbiology course in my undergraduate. They had a portion of immunology in that micro course, and that really got me going on to becoming an immunologist and trying to work in there. So after my master's, I went to work in a research laboratory doing tumor immunology. Actually, we were looking at immune suppression caused by murine, that's mouse retroviruses. And this was in the mid-1970s, long before HIV and AIDS really hit. So we were kind of ahead of the field and looking at immune suppression caused by these types of viruses. But then I developed an allergy to mice. And most immunology research work is done in the mouse system. So for all of you who worked during COVID, you can imagine how I was dressed working with the mice in the mid 1970s with a respirator, full gloves, mask, head cover, and everything else, and getting rid of all of that before leaving the lab to go home. Then I kind of moved to another lab that was doing human research. And at the same time, this was in Akron, Ohio, and at a hospital, kind of in a physician's office lab, if you want to think of it in those terms, but it was more than that. It was a lab designed for research, but we also started to develop our own clinical assays. And this was pre-CLIA. So we really didn't have any regulatory, didn't know what CAP was, I didn't know what CLIA was or anything at that particular point. This was the early 1980s. And at the same time, I started a PhD program because I figured if I wanted to progress in the field from a research standpoint, I really needed a doctoral degree as opposed to the master's. And we developed our own assays. I got to know some people in the pathology department at the hospital, what is now called Summa Health in Akron, Ohio. And the individual I was working with left to go to another position, but I was far enough along in my PhD program, I really didn't want to leave. And the people in pathology said, why don't you come over here and direct our clinical immunology laboratory? So I really had no idea what that was at the time, but I wanted to stay where I was. It was a little bit of a pay increase. So I said, sure. And it's like Alfonso and Terry mentioned, stepping out of your comfort zone and going into a place where I knew immunology, probably know more about immunology than the people working in the lab, but I had no idea what a clinical laboratory was. I wouldn't know the difference between an RPR or an ANA or what anyone else was doing in the clinical laboratory. So I spent a lot of time down working with the MLS, which were called medical technologists at the time, now medical laboratory scientists, and spent a lot of time with them actually learning what actually went on in the clinical laboratory. And I learned that I could translate that information to the physicians who really had a lot of questions about the laboratory testing. And it's that interaction between the laboratory and the medical field. And it gets to that kind of that quote that I have on my slide, that every specimen belongs to a person, to a loved one. And to be able to provide that information to the physician to help them care for that patient is extremely important and was really, to me, life altering. That was, okay, this is really what I want to do. I didn't have the creativity, the real science creativity to be a professor and get grants and really do all that from the science standpoint. But I did have the ability to take immunology and eventually molecular biology and translate that into a way that physicians and patients would be able to understand, and also to work within the laboratory field to kind of advance those fields. As Terry mentioned, I got involved early on in going to meetings and meeting people, and was eventually asked, like Terry was, to be on an ASCP exam committee and the immunology exam committee. And if I could pick up on what Alfonso said, I said yes. I didn't know what I was getting into at the time, but I got there, and like Terry, my first meeting is, what do I do? And with all these people who I've read about, and all of a sudden I'm working with people who have written textbooks and written these things and going, wow, this is kind of cool. And that led to all sorts of opportunities, not only in ASCP, but also in the American Society of Microbiology, which had the board exam. They actually sponsored the board exam that I have. I don't have an ASCP certification. And I have but the ASM actually sponsored the immunology certification at the time. And then I got involved with that group and started to write exam questions for that particular examination, and was fortunate enough to be elected to direct the diagnostic immunology division of the ASM. And so that, again, it opened doors to meeting other people and getting involved in additional activities. My involvement at ASCP eventually led to me working on the flow cytometry exam committee, which led to an experience working with the PEPFAR program. The PEPFAR program, which I certainly hope continues, the President's Emergency Program for AIDS Relief, and many of you may be familiar with that. And I was fortunate enough to develop training modules that were used in a variety of countries, and had the personal experience of going to a small country in Africa called Lesotho and do laboratory training for HIV testing in that particular country. And again, the individuals that you meet there, and stepping out of your comfort zone. I was 55 years old, leaving North America for the first time in my life to go to Lesotho in Southern Africa, trying to figure, do I really know what I'm doing? but it hit me. And this is the thing that I hope you all have, a kind of a moment in your life that each of you have. It's, I'm doing exactly what I want to be doing at this particular time. And I think getting to that point gave me the confidence, at least, okay, yeah, I can I can go and try and do this. So that involvement with ASCP has led to a number of other involvements there, including working on the Board of Governors for the Board of Certification with Susan Harrington and many other very excellent individuals. But as I kind of grew in this position and was working at Summa Health in Akron, Ohio for many, many years, I either was very smart or very lucky because I decided it was time for me to retire from Summa in 2019, September of 2019. And at that point, I picked up a half-time job with a laboratory that's now known as Insight Health, which was primarily a research lab that was now wanted to have part of their laboratory CLIA certified and CAP accredited. So that was an opportunity for me to actually take my previous career in research and combine it with my clinical expertise to help get that laboratory up and running, to get CLIA certified, CAP accredited. And we eventually did very well with a number of different assays. And I recently retired from Insight Health and picked up a couple of other smaller laboratories that is kind of a similar thing, starting out, getting them CAP accredited or accredited and CLIA certified, and working with small laboratories that are outside of my comfort zone, no longer working with blood. The two laboratories I'm dealing with, Synapse DX in Maryland works on, does Alzheimer's testing on a skin biopsy, and a new lab that we just started, PS Fertility in Charlottesville, Virginia, works on male infertility with sperm specimens. So it's flow cytometry, so it's something I'm very familiar with, but it's very different stepping outside of your comfort zone to get into this area. And I think the ability to have good communication skills, being able to communicate with physicians, with medical laboratory scientists, with the patient population, with regulatory agencies, all of this is involved in the overall career path that I think somebody can take in this laboratory. So when you get into the clinical laboratory and you see all the good work that can be done, but there's so many other opportunities that one can become involved with. And I think that's a very good advice that I would like to have. To me, the best way to build bridges is this area of communication. And I mentioned problem solving as a valuable skill. That's also partially communication. But one thing I learned, actually, Susan, from another microbiologist who worked with me in Akron at the time, an individual named Tom Thompson, who has progressed very far in the microbiology field. But Tom impressed me one time because we were sitting there talking, and one of his technologists came into him and said, "Dr. Thompson, I have a problem." And Tom turned around and said, "Great, tell me all about it and we'll solve it." So it's the idea that you have a problem, it's not bad. That's why we're here. If people didn't have problems or didn't have things that had to be changed or improved, they wouldn't need all of us. So our job really is to help solve these problems, and they can be minor problems. It's okay, I'm evaluating an instrument or doing something here. We had a problem, this instrument didn't work today, what's going on? Can I deal with that particular problem? It can be an issue where a physician calls and says, Tom, I needed this result 3 days ago. You haven't given it to me yet. Patient's going to die if you don't give me this result immediately. What are you going to do about it? Okay, that's a different kind of problem, but it's the kind of things that I think are very good and very important part of the laboratory aspect. So communication, problem solving, very, very important. Trying to get outside of your comfort zone, as everybody has said before me, but is what really moved me along. You don't get ahead by just doing your job well. You need to actually step out of your job and show that you can do more than that. And that will, I think, get you ahead in the field. And it's not so much personally getting ahead in the field, but moving that field forward. Our goal is to be able to provide proper laboratory testing and excellent results to help physicians in their care of their patients. So that's our goal, and we want to keep improving that aspect. And to do that, we have to improve ourselves and then improve the field, which will allow better care for patients and better outcomes. So I think that pretty much sums up the other things I've been involved with. I'll mention part of the laboratory field, as I think is an important and very useful aspect, is being involved in doing laboratory inspections. Terry mentioned going out and doing the accreditation inspections with NACLs. becoming a CAP inspector or a CLIA inspector, I think is very, very important, very useful, because it gets you out to other laboratories. When we go out to other laboratories, your goal is to ensure that they're doing things associated appropriate with the qualifications and the certification standards, but also to learn. They'll learn from you as you go to these other labs. But I have learned many, many things from going out and doing CAP inspections. In fact, I've got a wonderful assay validation protocol from doing inspection from a laboratory. It wasn't mine. We got that from another lab that I had inspected. So again, this idea of communication, stepping outside of your comfort zone, working across the field with your laboratory personnel, with the physicians, with regulatory agencies. These are all involved in building bridges across the whole laboratory field and improving the care that we can provide to the patient. So with that, I think I'll turn this back over to Sachin.
Thank you so much, Tom. Appreciate it. First of all, I would like to thank ASCP for inviting me as a panelist, and great job, everybody, and my fellow panelists. They did a great job in explaining their journey and the career advice. It was fantastic, and I will really mimic some of those advices in my career trajectories also. And then my moderators, Giovanna and Dr. Harrington, thanks to you, and of course, 400 plus attendees who have been attending this session across the globe. So I would like to thank everyone for joining us today. So my name is Sachin Gupta. I am the Scientific Director at the Center for Quality and Patient Safety at ASCP. So let's start. Next slide. So who am I? So I, like others, I also share a great diversity, in my experience and coming from outside, outside the world. From India, actually I have a different background. So I had a bachelor's of science in medical lab technology. I did that in India. And at that point, basically, I worked as a medical lab scientist on a bench for a couple of months. And then I was thinking to progress, to do something else. I just really wanted to progress myself and see myself in a different role. Not like, I still wanted to do something for patients. So that is my purpose. Think about your purpose. What is the purpose of what you're doing? So my purpose was to serve patients, right? To do something in the healthcare. And with that idea, I did my master's in biochemistry and then did my PhD in immunopathology. And then when I came to States to do my postdoctoral fellowship, I was working on at University of Miami as a postdoctoral fellow and then scientist. And then my intentions were to learn something else. I wanted to do something else. Again, the goal was to learn and do and add and progress, right? So I did my MBA, executive MBA in health sector administration and policy. And during my MBA, I was thinking like how I can add something like I can mix my lab experience and do something for the patients again, right? So I choose quality improvement as my area of expertise. And I actually, during my MBA, I did my Lean Six Sigma green belt, and then I progressed to Lean Six Sigma black belt, where you learn on improving the processes and reducing the variations in the processes in the lab, right? So, and then going forward, I also did my certification in CPHQ, which is a Certified Professional in Healthcare Quality by NAHQ. So this is my education. Now regarding my experience, as I said, I came from India about 20 years ago. I did my postdoctoral fellowship at University of Miami. And then after my MBA, I moved to a health system, like a 15 hospital health system, Baker Health System in Tampa, Florida, where I joined as a performance improvement project manager, where I was working on projects, on the lab projects. As you can imagine, lab is so significant. It impacts so many conditions. It impacts 70-80% of the clinical decisions. You all know that, right? So I was working on many processes, and with couple of years of experience in that area, I actually became the director at Baker Health System for lab quality and data analytics. That is where I was managing the team who was, they were responsible for making sure they have all the labs are up to date in terms of the compliance and regulatory stuff, and also the data piece. I actually was, I learned actually during my training, during my role at Baker, that how the data is so important in making that decisions, in making impact, how the labs can add value to the patient care. I'll come to that in more detail in a minute. And then like just a couple of like 1.5 years ago in 2023, there was an opportunity. I was already working at ASCP as a volunteer in many committees, and I joined as a scientific director at the Center for Quality and Patient Safety. So that this is so far my job, like my experience, and then at my current responsibilities, what I do at ASCP, I basically I'm developing this National Pathology Quality Registry, which is a basically diagnostic insight platform where we can use data to make improvements in the processes, like turnaround times and test utilizations. So we are in the process of developing that platform. And then also, I am also part of some effective test utilization initiatives, some committees where we design this best practice and evidence-based medicine recommendations. I don't know if many of you might know Choosing Wisely recommendations. So now we have these effective test utilization recommendations, ETU recommendations, which we have a committee, and we all together review those recommendations and put out those recommendations for people to use. So there is a link actually you can see for the effective test utilization. And then I'm also involved in some research activities at ASCP where, we just finished a project for communicating effectively urgent and significant unexpected values in anatomic pathology. There are a lot of gaps in communicating those values to the caregiver. So I just finished a project, and we actually published some recommendations for effective communication of those values in anatomic pathology. And then I'm also involved in some educational activities, just like you might have seen when we just started this presentation. We have some educations like micro-learning, case-based studies on blood culture education, and then on the test utilization. So I was also part of those activities. And then, of course, as a subject matter expert, I also participate in some of those other activities at ASCP. Now, talking about my formative experiences in lab career, I think when I came to States, right, and I wanted to continue my career in the labs, of course, I came to know about the ASCP international certification. So first I did that. Then I also did the molecular biology certification. And then, of course, my MBA helped me to grow myself and learn more about the management and this quality improvement, skills. And then when I get to work on the quality performance improvement projects at Baker Health System, one thing I realized when I was working on these projects, like how much data is so important, that without data you cannot get any insights. It's so difficult to get to know what, like, if you don't know your baseline, you don't know what is needed, right, for the improvements. It's so important. So that is where I think I learned that the data is very important. And I learned when I was working at Baker that all those skills like Tableau, all those like data modeling, data analysis. So I skilled myself on the data analytics skills. And so those are the things I think which made me actually experienced and skilled in those data analytics and performance improvement projects. And then how I build bridges within the lab community. One thing, again, working on these projects, and again, so many projects I've worked on, one thing I realized is connecting with the team. Go to Gemba approach, and this is one of the lean approaches. Go to Gemba means go to your step, go to your process. It's not like sitting in an office, you cannot know what is going on in the at the bench. So you have to go to the bench. You have to really feel that what is going on. So that is called a go to Gemba approach. Basically, you have to really know how your frontline workers are feeling, how the process really works, how the labeling works, how the process works. So basically all that go to Gemba approach is so important. So I feel like that is what I have been teaching, and that's what I've been learning throughout my career, that you have to really have that go to Gemba approach. Okay, that's number one. Number two is the process focus approach. Yes, we always say, everybody has their opinions. We always say it's a people problem, but of course it's a people problem, but people problem comes from process, right? So you have to have a process focus approach. You have to really have that robust processes that you don't have any problems. Again, going back to the process improvement, you have to have very good processes so that you don't have any problems. Again, right? It's a culture. So process focus approach is so important for any organization. And then most importantly, as I mentioned, learning about data, I also learned that how labs can add value to improve patient care. You won't imagine we work at the bench and we get busy in our day-to-day activity, but we don't realize how much difference we are making in somebody's lives, right? You all understand what a critical potassium means, what a critical troponin means, what a low hemoglobin means, right? You all are lab scientists, so you understand the medicine, right? So that is where I was just doing one step further, analyzing that data, consolidating that data together, and doing those trends, and taking that data to our clinical partners, to our clinicians, to show, hey, you are overutilizing this test, you are underutilizing this test. Whenever we bring new tests to our lab, how a new test will make a difference, right, in the patient care. So basically, we all need to understand that how important this profession is, right, and how each one of us is making difference in the patient care. And of course, some opportunities of interest like data analytics training. Again, if you're interested, you can pick any data analytics tool. Actually, as a matter of fact, you can start with Power BI, even Excel. Power BI is now part of Microsoft, and Tableau is another application. That is where I started. I started learning Tableau and how using the lab data in Tableau, how I can visualize, how I can analyze the huge amount of data. So that is what I did. And then, of course, if you're interested in the process improvement area, or lean, which is a waste removal, removing the waste from your processes, Lean Six Sigma certifications are also available. You can, of course, advance your career in Lean Six Sigma. Again, a fantastic profession, a lot of opportunities in the process improvement arena. So you can actually do that also. Now, in terms of the valuable skills, I think, in my opinion, if you have some of these soft skills, you will learn how to get to the technical skills. So just like others said, you have to be a constructive disruptor. So again, earlier I was thinking like maybe I should put disruptor, but these days you don't want to be destructive disruptor. You have to be a constructive disruptor. Be in the area, just do something, be disruptive, so that everybody can notice you, right? So be a constructive, be positive disruptor in your profession. be logical, be positive, be nimble, and be passionate. So again, passionate is a very important word. If whatever you are doing in your profession, in your area, have a passion about it. If you are learning something, have a passion about it. Whatever you do in everyday life, have a passion about it. Don't just do it for just doing it. Okay, so do it have a passion of doing something. And most important thing, which I learned over the years, that as a human, we always think that I'm right, we are right, and we don't realize, we don't see things from the other's perspective. I think we, in this profession and healthcare profession, we always need to realize that we are working for our customers, and our customers are our patients, our providers, our nurses. So sometimes we have to see things from the other's perspective, right? So have that nimbleness and then that compassion in you for the patients, for the patient care, right? So I know we always do that in a healthcare setting, but I feel like that is we have to keep remind ourselves that that we have to see things from the other's perspective. So in terms of my quote, I just don't have one quote. I feel like there has to be multiple quotes. Again, see things from others' perspective, from a customer's perspective or consumer's perspective. Keep learning each and every day. Like Terry said, like Alfonso said, like Tom said, keep learning each and every day, keep learning anything new, and not just learning, teaching also, because teaching helps learning, right? And be passionate about whatever you do, just do with a complete 100% passion. So with that, I will pass on to our moderators, and thank you again so much.
Okay, so thank you so much to all of our speakers. It was amazing to hear your personal journeys in your careers. And, you know, it takes a lot to share that. And so we really do appreciate that. And, you know, one of the things that resonated for me throughout all of your talks was everybody was saying yes, you know, say yes to the opportunities. So I think that's something that we all take away and need to remind ourselves all the time. Of course, we have to watch that we don't get too busy, but if you don't say yes to opportunities, you don't grow. So I'd invite all of our panelists to show themselves on the video now as we enter into our question and answer session. And so I'll ask the first question. We had some great questions put in the chat. And the first one will go to Alfonso. So at your place, do you have a mentorship and succession program? And if not, what would you advise someone in order to, you know, get that mentoring? I think we all love to be mentored.
Hi, yes, absolutely. And thank you very much for the question. That is a very good question. Of course, one of the items that we have in place is we have our ASCP mentorship program. And then as well as we have the ASCP Texas Riverwalk chapter communities. That way we can communicate with our peers with one another. They can also communicate directly with me, so that way we can receive the mentorship or discuss some of the steps that I've taken in my career path. And I like to share that to you know, whoever you know, is interested in the knowing, you know, what the steps I've taken and how I've developed myself and being the leader that I am today. As part of like within our organization, of course, you know, I've taken advantage of the mentorship programs that are also available to me by the place that I work at, like such as our Management Development Academy, so that I can learn the leadership's skills that are in place to see, it's like, you know, make that transition from a tech to a supervisor, or a medical laboratories scientist to a supervisor. That way, you know, that transition can be as smooth as possible. It is a continuing learning experience. A lot of them too is like, you know, all these formative experiences that I've, you know, I've discussed today are like, you know, are definitely like great stepping stones to allow for growth in the career path. So thank you.
That's awesome. Just want to say thank you again to all of our panelists. You gave us a lot of great nuggets. Keep learning and being able to stretch ourselves. I like that Terry mentioned focus on one thing. Sometimes we can get very busy doing a lot of things good, but focusing on that one thing so that we can be great, working across our field and our industries and collaborating with other stakeholders, being passionate about what you do. So all of those were great nuggets that you all gave, and really just saying yes. So this next question is for all of our panelists. And of course, it's around leadership, which is one that I am passionate about. But can you talk to us a little bit about how you receive leadership training in the profession, and maybe where, because sometimes being technical leaders, we're so used to getting technical training, but when it comes to that soft skills training and emotional intelligence and leadership, sometimes we are not sure where to get started as professionals on the bench or at the bedside with patients. So I will open it up to the first panelist that would like to jump in and talk to us about how and maybe where you receive leadership training. Terry, I'll start with you if you would do me the honor.
Yeah, so I kind of mapped out my own kind of career leadership. I had some great managers that kind of encouraged my comfort zone, I should say, because I, had someone from ASCP come and speak at, different graduations. I've met a lot of people through ASCP. And so those people were very instrumental in saying, hey, get involved with the exam committee, hey, let's go, do, something over here with regards to speaking at a conference. And so my managers really encouraged my behaviors, I think, more than anything. So it's not like I had a particular, leadership, class or anything like that, but I think just their encouragement, coworkers working with me to, like I said, get out of that comfort zone and try new things, because you're thinking, well, what do I know? Like, how can I write a document, or how can I be on the exam committee? And like, well, you have the knowledge, you have the experience. So, why don't you share that with the world? And so I think that was kind of really instrumental, is having those people in your backyard to kind of, push you forward at the gate and say, hey, go try something new. And that's kind of where my leadership kind of came from, my peers, to kind of get me out into the world.
Yeah, I don't think I ever had a formal leadership course or training. I think I can even go back though to my parents, and who basically pushed on both my brother and I that this is what you do. You get involved in your community and you try and move it forward. For my brother, it was more of a civic issue. For me, it was more of a professional community. I've always liked being out front. I was a drum major of a marching band. I used to referee basketball games, so I don't mind being in front of people and trying to take a leadership position. But I agree with Terry that a lot of it comes from our managers and our people who have who we emulate, and we look up ahead and say, "Whoa, I like what that person does, or I'd like to be able to do that." And for me, one thing in my career path was having an individual who actually wrote the first textbook of immunology that I ever had, and said, Tom, I think you need to be more involved in the leadership of this organization. That was the Association of Medical Laboratory Immunologists, a small immunology organization. And but Dr. Belanti was very helpful to me in pushing me, and also Dr. Noel Rose, another individual who was a leader in our field, kind of pushed me toward getting involved and getting more involved in leadership activities.
Yeah, I also resonate, Terry and Tom. I think I also didn't had any formal training, but I think it just comes naturally from your peers, and also I feel like the culture of your organization also prepares you to be a leader. Actually, once you have somebody in your team and you are you have a direct report, you just learn how to be a leader. I feel like you just learn from them. And again, I think, as I mentioned, you have to see things from others' perspective. You have to put yourself in others' shoes sometimes, right? When you do that, you start feeling their pain, feeling their concerns, and you just get better at it. I feel like. So I feel like if you are a good person. It comes naturally to you. Sometimes I wonder, can leadership be taught? I feel like yes, but I feel like more importantly, it comes just naturally. So again, you have to be just learning and just try to see around, look, observe people, observe good people, and naturally the leadership traits will come to you.
Yeah, no, I definitely can relate to that, to all the other panelists, because a lot of my leadership experience comes from, like the mentoring, all those programs were after the fact. Of course, when I started, I didn't have a whole lot of leadership or management experience. Therefore, a lot of the experience occurs like right there at the moment. And for many folks, I mean, you'll see the successes, but then you don't see all the other items that go into building those successes as you move forward with anything you're doing in the laboratory. And a lot of them, it's just like, hey, you know what? Don't be afraid to fail. Definitely try. Do your best at the task that you are, assigned to do. And from those experiences you learn, you build on that, and then you take it on to the next. So these are a lot of like lessons learned from a previous project or a previous task that you take with you as you progress through your career. So definitely a lot of leadership is learned as you go through your career. But definitely it certainly does help, like, also attending the other courses that are available to you, elsewhere within your organization if they are available. Thank you.
Thank you. So somewhat related to that, a question for all of our panelists that, would like to answer. So how do you facilitate changes in your institution or, in your laboratory or within your program when folks are resistant to that change? If your technical staff is resistant or the other educators are resistant to a change that you need to implement, maybe because it's required for CLIA or your institution, or just the process isn't working and you have to get them on board with something new. Can you talk a little bit about your experiences with that?
Yeah, I'd like to take that one. Of course, from a project management standpoint and from, all the previous projects that I've learned is that, when employees are resistant to change, it's always crucial to get them involved, have that clear communication. If you have that clear communication, you're going to ensure that the reasons for that change are clearly articulated, and you want to explain the benefits to both the team overall and what the goal is. And the transparency helps the employee understand the why behind the change, as well as, it also takes away the fear and the uncertainty. Also, you want to have the involvement from the employees in the planning and implementation of the change, because by getting their input, they're going to feel more invested. And we can see that, that their concerns are being addressed at the time, which helps reduce the resistance. Training and support are another key item, because you want to provide the adequate training and resources to ensure that your staff, your employees, they feel equipped and confident in adapting to the new processes, as well as you want to have the ongoing support through the mentorship and the peer collaboration to help smooth the transition. And also active listening. Active listening is key. You want to listen to the concerns, the feedback from your staff, as well as, you want to allow to address all the issues early on and show the team that their opinions are valued. And then, of course, you want to celebrate the small wins, the small victories as you go through the change process. And so that way you can build the momentum and motivate the employees to embrace, pretty much build, and embrace during the transformation.
I don't think I could add anything, Alfonso. That was great. The idea of ownership and communication with everybody involved. Wonderful.
Yeah, I totally agree, Alfonso. Good job. But just one thing I would like to add, sometimes you need to use top-down approach where leaders have to step in into that role, right? Sometimes we think, why we are the only one who have to go through change. Why not our leaders have to go through change? So sometimes leaders have to step in and go through that process also. But you said it right, explaining the reason, like why we are doing it. And sometimes what happens with these technological changes as we see these days, it really helps in improving efficiencies, right? It really helps, making the change sometimes is good, right? Most of the time changes are good. So it really improves the processes, it improves the productivity, it improves the efficiency. So it really makes your life easy. So if we can explain that, if we can, describe that to the team, that yes, this is the idea, this is what we are doing, this is why we are doing. And again, the outcome perspective is very important, like why it is important. I think that is along with what you just said, explaining why piece is also very important.
And I think, from our, even just thinking of our laboratories perspective, sitting on our, phlebotomy best practice team, I mean, we have somebody from management from all of our hospitals, our clinics, and our mobile teams. So whenever we have a change in a policy, if we have an updated policy, the standards may have changed. Sometimes that's hard to get people to change their ways. They become comfortable with a particular policy. They don't see the, benefit of the new change. But we want to make sure that our phlebotomy best practice team takes those new changes back to our team so that they themselves, can practice those, and make those part of their their everyday routine. Because, we practice, everything every day. You have a set routine for doing things. And if you start to change that or alter that, that could have significant patient impact. And so one of the things I teach my students is to always think of the end result first. So the end result of everything we do in laboratory medicine is what? It's the patient. And so think about anything you do in your life. Okay, if you want to speed, that could result in a speeding ticket. It could be loss of your license. It could be the death of an individual. If you decide to jump out of an airplane, same thing. Like, well, I might get an exhilarating ride, but what are the other repercussions? What's the end result? And so in healthcare, there is only one result, and that is the patient. And so I strongly advocate for those patients. And I make sure that we have the proper policies and procedures, and we make sure that our staff has those, to take out to their staff so that they can be, implemented, and making sure that their staff are actually following those.
Those are good. And then thinking about the active listening, and there's a quote that good leaders ask great questions. So in those times of change and those times of implementing new things, getting good with asking great questions. And I know one of you mentioned getting good with communication in your presentation. So the last question that I have, and it's open to any of the panelists that want to answer, is as we think about building bridges between the lab and other areas in the clinical areas, what do you think about the role of the Doctorate of Clinical Lab Sciences graduates, or the DCLS, in the future of building those bridges? And I'll open that up to, yep.
I'll start with that one, because that's been a big issue. It came with the time I was on the Board of Governors and how we were going to do that. And I think the DCLS is a great way to move forward. And there is a move forward, and there will probably be an examination sooner or later. There's been a committee created to now work on that. So there will be an examination that will be hopefully CMS approved as a CLIA director level exam. We got the immunology board certification from ASCP approved by CMS, so we have a track record there. And I think the DCLS, to me, the DCLS is a great way for somebody who really wants to do a whole laboratory. If somebody wants to do a particular section of the laboratory or take a particular board level certification, that would require, I think, additional training above and beyond the DCLS. If you want to do it in clinical chemistry or microbiology or molecular immunology, The DCLS by itself won't qualify you for those areas or those exams. You'd still need additional postdoctoral, some other type of experience. But at the same point, it gives you a pathway forward to move to a CLIA lab director level examination. So I think it's an up and coming career path, and I think it's very good, and I'm glad it's there.
Awesome. Dr. Harrington, I'll turn it over to you if you have one final question, or you can start our wrap up.
So I'm going to ask each of you to, in 1 or 2 sentences, tell us what you love about the profession of laboratory science and what keeps you interested in this field. Rapid fire, 1 or 2 sentences. Start with Terry.
For me, as I kind of mentioned, I found out very early in my career in high school there that I did not really like to see blood coming out of a person, but it took on a whole different meaning when that blood was in a test tube, and kind of seeing that through from identifying the patient to the testing to the results and getting that end result to the patient. I think that was the best part for me, is that I saved a life today. I made a diagnosis today. I helped that patient get the right medication today. And so I always tell the students too, like, sleep well on your pillows tonight, because the decisions you make today and every single thing you do is going to impact that patient's life. So, or not, right? So I think for me that the best thing has always been the patient, and I'll continue to advocate for them.
Yeah, for me, it defines the purpose of my life, that I'm doing something for patients every day. May it be through bench work, may it be through data analysis, may it be through making improvement in the processes, may it be through leadership, may it be through anything which we can contribute to improve patient care. So as I resonate with Terry, but I feel like this is the purpose of my life, that I'm happy that I'm doing something for my patients.
I can definitely echo that. I'm glad to be part of the laboratory profession. Of course, one of the big things of why I'm on this career is because we are making a difference, behind the scenes. So, pretty much, all the experiences that I've had with throughout my career path, that has helped, us make a difference in the patient care, regardless of where we're at as far in the laboratory career. As you can see, it's like we're either starting at the bench or in the administrative end. We all have a common goal of, having better patient outcomes. Thank you.
Yeah, I agree with everything that's been said. For me, it's the ability to know that what we have done in the laboratory has affected a patient for good and helped out. And now in my kind of later years and dealing with more smaller laboratories and not dealing with clinicians as much, the idea that we can actually help develop new tests in new laboratories to keep things moving. So those 2 aspects have helped me in my earlier career and now in this part of my career.
Okay. Thank you, everyone. The patient, right? So as we wrap up here, we're going to remind everyone that our next webinar will be on April 16th, just before Lab Week. This session will feature 5 inspiring laboratory professionals who either serve as laboratory educators or promote visibility of the laboratory through community outreach efforts.
And another exciting opportunity, ASCP's Ring Scholarship has opened, and the application window for laboratory science students from medically underserved and or rural areas. The application is open through May 30th. We encourage you all to help us spread the word. Please do your part, spread the word of this amazing opportunity to interested and eligible students that could benefit from the opportunity. Our team will add the link to the scholarship website in the chat. So please share it out. And finally, we are offering 1.5 CMLE credit for this webinar. Instructions will be emailed to you tomorrow via Zoom. Credit can only be claimed by live attendees within 1 month You have 1 month to claim your credit of the webinar date.
So with that, we'd like to thank all of you for coming to today's webinar. Encourage you to visit our site where you'll find more information on all of these opportunities at supportcdc1lab.org. Thanks again to all of our speakers, to Tawana for co-moderating with me, and to the organizers at ASCP. So a lot goes on behind the scenes, and we don't want to forget the folks that make it happen. So thank you all. Have a great day.
Thank you. Bye.